welcome back. Today we are here again with Mr. Ravi Sharma, our Group Chief Pharmacy Officer at Burjeel Holdings, and we have a very interesting podcast to tell you about something that is new to me and probably to most of you. We're going to be speaking about pharmacogenomics, right?
Yes.
So let's start with that because such a new term to me. Please explain to us in simple terms what pharmacogenomics is.
Thank you for having me again. So pharmacogenomics is basically looking at how your individual genes influence the way you respond to particular medicines. And why pharmacogenomics is particularly transformative within healthcare is because being able to give doctors or prescribers insights of how your body will respond to particular medicines enables us to make sure we prescribe the right medicines for an individual and reduce the harm or side effects associated with certain medications as well. So it's a form of precision medicine, personalizing treatment indications based upon patients' conditions, but based upon how they will actually respond to medicines.
Oh wow, definitely we're advancing a lot. Okay, and how does the pharmacogenomics actually work in practice? How a person's genetic makeup influence how their response is to medications?
So each and every single one of us has genetic variations or genetic differences, and these influence the way we absorb, metabolize, excrete, and respond to drugs particularly as well. So each of us will respond slightly differently. So being able to understand those genetic markups and those pharmacogenetic markers will enable us to understand that this drug works better in one person versus another person, therefore being able to ensure that they get the best outcomes from their treatment, and as I mentioned, reducing the side effects associated with certain medicines as well. And this is commonly used in practice at the moment. For a good example, if we look at oncology, for instance, at Burjeel Holdings, we screen patients before they start some of their particular medicines to ensure that we tailor the medicine's information, we get the right treatment based upon their protocol to ensure the most optimal outcomes for cancer care with causing the minimal type of side effects to a particular patient. So this is common practice, and what we're trying to do now is just scale it up, make it more common, make it more preemptive testing before even we start treatment.
Okay, you definitely went ahead because you were answering you, I was thinking, I was like, okay, so the person gets tested first so they know the genetic makeup and according to that they develop. Yes. Wow, very impressive. Okay, and from your perspective, how has pharmacogenomics changed the way pharmacists and doctors prescribe today?
Well, it's been transformative, as I mentioned, in relation to the case study example. But if we look at clinical areas where there's been the most significant evidence in, we look at areas of cardiovascular disease, we look at the areas of pain management, oncology care, and psychiatric medicine, such as antidepressants as well. We're seeing huge amount of evidence base in there. Some evidence which I think is important for people to understand, that 30 to 50% of our drug responses is variable because of our genetic makeup.
Correct.
One particular study within 2023 called the PREPARE study demonstrated that within a cohort of patients who had pharmacogenomic guided treatment therapy were 30% less likely to experience side effects versus those that experienced standardized care and full routine of treatment. So being able to understand that, you're able to make really precise, decisive decisions about patients in collaboration with patients, their families and carers, but in a much more thought through way and a much more personalized way as well.
Okay, that's very impressive, I guess, because again, a lot of issues that we have with a traditional pharmacy or traditional is the side effects. And now obviously the safety and the outcome is probably being better.
Absolutely, and I think what we're talking about when we're talking about pharmacogenetics is using genomics as a very important area of medicines to be able to ensure we get the best outcomes for patients. We're able to ensure that there's no side effects or harm caused by medicines, as you quite rightfully said, and there's huge efficiencies in that because you're able to, instead of prescribing 5 or more medicines as a sort of trial and error methodology, you're able to get the medicines right the first time for a particular individual. And where we've seen this, particularly if we look at Europe or UK or America, for good example, is whereby guidances are based, or when we're prescribing, we look at guidances and they're based upon cohorts of people and they don't take those genetic variations into consideration. This enables us to really personalized medicines for you, for me, for any of our viewers by having this screening done earlier to be able to tailor those interventions much more appropriately.
Perfect. And I want to ask you, since it seems there's quite a process because obviously the patient needs to be tested and everything like that, what about the cost?
Yes, so from a perspective now, in some of the healthcare systems, this is already covered. So, I think from a United Arab Emirates perspective, they've developed a very good program called the Emirati Genome program, which has been very well established across the whole of UAE. And it's advancing the infrastructure, the framework and the foundation for us to be able to leverage personalized medicines interventions, but also really well-informed and futuristic diagnostics as well. Particularly within the Emirate of Abu Dhabi, for instance, and the Department of Health have allowed pharmacogenomic reports to be released into patients' medical records through something called Malafi. So as a clinician, if I'm looking at someone's medical records, I can look at the Malafi, I can able to understand their pharmacogenomic report and pull that information to be able to prescribe effectively for those particular individuals. So actually we're seeing that in real life and advancements in healthcare within the healthcare system we're currently in. So it's actually becoming real life. It's in a transitionary period. We need to increase its uptake to everyone in the population, which is a challenge in itself. But once you get to that stage of preemptive testing patients before, you'll be able to make treatment interventions for everyone and hopefully collectively reduce side effects.
Wow, extremely impressive. And how is the UAE implementing and approaching this transition, right? Like you say, how is pharmacogenomics being applied in other countries? Is this already very established in other countries, do you know?
No, I think the UAE is probably one of the most advanced in the world globally, actually, when you start to look at their infrastructure they're developing, which has been incredibly impressive. The genomic program that they're leading on is really setting the foundation, the governance, utilization of artificial intelligence to really precisely diagnose patients, but also treat them in a very personalized way. When you look at other healthcare systems, we're getting to a stage where we are starting to move to testing before the initiation of therapy. Normally, traditional healthcare has been, we've been following the guidance, we notice a side effect, and we might do a pharmacogenomic test to be able to see it.
So after the fact?
After the fact,
now
sometimes
you're doing it before.
So now what we're trying to do and what the UAE is trying to do is do it pre. At Burjeel Holdings, we've rolled out a pharmacogenomic testing program here as well, where all patients, whether you're from any walk of life, will have the opportunity to have a pharmacogenomic screening before we even start treatment across all specialisms, across all of our hospitals and medical centers as well.
Okay, that's extremely impressive. And again, it goes back to, so we can say for sure that UAE is a huge supportive of advanced technology when it comes to the medical point. And how do you think the transition is happening here in the UAE?
I think it's advancing considerably quick within the United Arab Emirates. As I mentioned, working in Abu Dhabi and working with the Department of Health closely, you can see they're already enabling pharmacogenomic reports to be available in patient records, which is allowing us to do really tailored intervention for the patients that we see. A particular study that was done within the UAE was in cardiovascular disease that showed that 96% of patients that were on a cardiovascular drug had a pharmacogenomic relationship where we could adjust their treatments to ensure they got better outcomes. They're really advancing research, practice, and implementation simultaneously. There are things with clinical adoption and implementation that need to happen next. So the UAE is developing the foundation for us to work on. And I think what we need to think about is how do we integrate pharmacogenomics into medical records, alert signs, training for staff, and equitable access across the private and public sector to pharmacogenomic testing for patients from all walks of life
everywhere,
to be able to make that difference to their healthcare and really bring precision medicine to life.
Yeah, we are in the UAE, so I'm sure we're going to get there rather quickly.
I completely agree with that.
And you mentioned cardiovascular and oncology. Are these the specific patients or group of people that are mostly benefit from this, or is there any others that can benefit specifically from this pharmacogenomics?
No, actually there's a lot of patients that benefit from it. If you look at the global evidence base, then we think there's probably at least 100 medicines that have a pharmacogenomic drug-drug relationship to them, and they're very commonly prescribed. So the evidence base from where we can see is cardiovascular, psychiatric, oncology, and pain management. But when you look at the full list, there are very commonly prescribed medicines that are able to have an intervention to them to optimally treat patients, even including epilepsy or neurological conditions. So I would say patients that are on multiple medicines or suffering from some side effects from their medicines, speak to your doctor, speak to your pharmacist and say, how are my medicines treating me? Can we optimize them the best way we can? Is there some form of pharmacogenomic relationship that could be there, and enabling us to start to look at patients slightly differently and much more personalized? Because healthcare is not about one size fitting all. I think we're getting to a modern day of medicine which is much more precision, personalized to you, and I think that's what the population requires as well. And I think that this is a core, fundamental cornerstone of that journey to personalized care through precision medicines.
Okay. This is extremely fascinating. I just want to ask you, and I guess this is a little bit of personal question.
Yeah.
How does it feel for you being able to understand that you are one of the first people to translate this information to the patients and to the doctors? Like, you have a big, how do you say, like a big responsibility in a way, but how do you feel about having that, being the person that is transmitting this great news of information?
Yeah, I believe it's a multidisciplinary team approach. Our doctors are very futuristic, they're very thought leaders in their profession, they're very supportive about innovative care being delivered. We're supported by our Burjeel Holdings leadership team as well around pushing AI, technology, digital diagnostic transformation right to the forefront of patients as well. So this adoption has been collaboratively agreed, and we're trying to implement it and drive it forward, engaging with patients, ensuring they feel confident about genomics and doing genomic testing, because that's a real key enabler for us. And then hopefully tracking patients to be able to see the progress that we make in their care. Again, good communication between us and patients and the doctors. So, it's great to be, from a Burjeel Holdings perspective, leading on transformation, but it's also about working together as part of a multidisciplinary team with doctors, the leadership team, patients, families, carers, to try and drive this type of behavior for the future and for the benefit of patients and the best outcomes we can potentially achieve.
Yeah, it's amazing, I have to say, as a potential patient, to know that people like you, like Burjeel Holdings, and the whole team is definitely working and developing the best medicine and care for the patient. So yes, we truly appreciate it. Okay, and looking ahead, how do you see pharmacogenomics shaping the future of personalized medicine in the UAE? I think you already explained a little bit about this, that people are now, or UAE is trying to make it more accessible to everyone.
Yeah, I think they've already progressed significantly across that, actually. And I do believe generally, if we think about the global context, pharmacogenomics will be a cornerstone of precision medicine, not just for the UAE, but for global healthcare ecosystems, actually. The great thing about the UAE, they have a fundamental Emirati genome program, which has set the foundation, the tone for the infrastructure, what the government and what the whole healthcare ecosystem is going to try and deliver for the future. I think for me, it's about implementation science now and getting it right and being able to ensure there's good clinical adoption. This requires, as I mentioned, proper integration into electronic medical records, education and training, not just for clinicians, but actually for the population about the benefits of what this is going to be, and that equitable access piece. We've got such a diverse population within the UAE, of course, as well. And there's such different demographics and the impacts of different cultures and different backgrounds and ethical backgrounds in relation to pharmacogenomic interpretation as well. And actually being able to do that research across the private and public sector, advancing precision medicine's pharmacogenomics is going to be absolutely future-proof. But I think the combination of clinical implementation, but the foundation that we currently have, and the investment in AI, digital transformation diagnostics, this will absolutely become standard care and routine care practice for patients as soon as they come to get their healthcare. They will be screened like a normal blood test, and like you would normally get a full blood test or a vitamin D test, it will be a pharmacogenomic test. And before we even think about prescribing, we will know exactly how to prescribe for that individual, what medicines work for them, what medicines don't work for them, and then be able to ensure that they get the best outcomes and best healthcare.
That's amazing. And last but not least, I just want to make sure, obviously, we're learning so much from you. How is this message of pharmacogenomics being spread across UAE to doctors? Are they open to this new development, or do you find resistance?
No, actually I don't. I think doctors always are trying to do the best for patients. I think we all are. I think as healthcare professionals and healthcare providers and ecosystem, we want to ensure the best outcomes for patients. New innovation, new technology, new diagnostics that can help us deliver that advancing type of healthcare, which is what the expectations are of the UAE government. We have to be at the forefront of it. And I think being able to drive that collectively with others, I think, is really important. But doctors are absolutely open to it. I think for me, it's about engaging with patients and making sure that they really are aware of the benefits of pharmacogenomics and genomic testing broadly and how it can benefit their care. And I think that's a trust thing, that's a confidence building thing. We see that from evidence-based, that the key fundamental enabler to advancing these new technologies is about patient confidence, public confidence in what we're trying to do. And I think the foundations of the Emirati Genome program are enabling that, and we need to also leverage that as clinicians and healthcare providers. Say these are the right things to do for patients in the best interest of your healthcare and outcomes.
Yeah, I think I was going to mention that, like, regarding patients, the doctors will understand the concept, but I guess patients sometimes feel like if they give too much information about themselves, it's not safe.
Yes.
But in this case, it's totally the opposite, right? Like, it's actually providing safety for future treatments, and obviously to more tailored care for them.
Absolutely, and that's the main aim of it. There will be some things that we need to consider as part of implementation, but in the grand scheme of things, what we're trying to drive is precision medicines, good outcomes, and medicine safety.
Perfect. Well, thank you, Mr. Sharma. Again, a pleasure. I cannot wait for the next topic of discussion with you, because every time I learn something new, and I think people kind of like, oh wow, now that exists, and you put it in terms that we all understand. So we appreciate you.
No, thank you so much for the time and opportunity. Really appreciate it.
Anytime, it's my pleasure. Thank you.
Thank you.